afternoon, everyone. This is DNM with Robin Kim, hosted by yours truly. For today's show, we'll be talking about the very serious issue of opium addiction. On this side, we'll have Dr. Jake Orchard, who will be explaining why you should avoid abusing opium. Opposing him, we'll have Eric Choi supporting the use of opium. Come out, you guys. Welcome. Nice to meet you.
Doctor.
Let's get started, shall we? Dr. Orchard, could you kindly give us some information on this drug?
Well, opiates are made from the plant, opium poppy. It's used to dull senses, relieve stress, and induce sleep.
Now, as a doctor, what are your recommendations or thoughts on this drug?
Actually, using opium can be legal if given with a prescription. However, I personally wouldn't recommend it to any of my patients.
And why is that?
If a patient does become addicted to it, then they must face a life-threatening list of short and long-term effects.
Yeah, but doctor, only about 1% of people who use it for pain become addicted.
Yes, but over 2.5 million Americans abuse prescription drugs. 10% of that is opium users.
So, Eric, you've taken this drug first-handedly?
Indeed I have.
Now I heard of many ridiculous treatments for opium, like Big O and white stuff.
Yeah, there's also black stuff, monkey, morph, and in this case, China white.
Now, why do you use opium?
It's an easy way to lower my stress, calm down for a short time. I mean, all you have to do is snort, smoke, or take it by the mouth or anally, and you start to feel like you're in paradise.
Isn't that only short-lived, though? Afterwards, don't you feel terrible and sluggish?
Yeah, but that's just the beginning. When I get some more, it becomes part of my daily life.
That sounds like an addiction. Have you ever tried going through any treatment process?
Oh, those are stupid. They never work, people. I mean, once you're addicted, you're stuck for it for the rest of your life.
That's not true. There are 4 different successful treatment processes that can be available to anyone. You can look through the yellow pages or very simply go on the internet. Basically, there's always an easy access to get help and recover.
Could you explain those treatment processes with a little more detail?
Sure. There are many different ways to deal with withdrawals, such as being closely administered as you slowly decrease the amount of opium entering your body. That's most common for long-time addicts. But there are also different kinds of medications and injections that depend on how serious each case is. Eric, I really recommend you. I'll talk to you later.
Doctor, I don't need your help. I'm barely showing any negative effects.
Dr. Orchard, you mentioned the short and long-term effects. Could you explain those?
Short-term effects would be what Eric is experiencing now. That includes vomiting, constipation, drowsiness, difficulty breathing, fatigue, weight loss, irregular heartbeat, hallucinations, and mood swings. Long-term effects are what Eric will soon have to face if he continues his addiction. This would be damage to his bones, blood, brain, kidney, liver, and muscles, coma, and possibly death.
Well, Eric, you still want to use opium?
You know, I only suffer from a few of the things listed, just tiny bits, so I think I'm okay. I mean, I feel like opium really helps me.
But I'm sure it's not all good. You've had to experience or notice some sort of negative response to opium.
Well, actually I have. Just a few days ago, I saw in the newspaper that 8 American soldiers died in Afghanistan from overdose of heroin, morphine, and other opiate drugs.
And after hearing that, you don't feel worried?
Well, now that I think about it, I mean, I guess I'm a bit scared.
Eric, I'd be glad to help your recovery. And for all of the other drug abusers out there, I would best advise you to receive treatment and live a longer life.
Thanks, Doc.
That's it for today. I'd like to encourage you all to listen to Dr. Orchard. Let's all live our lives long and healthy. Thank you, Eric and Dr. Orchard, for your time and knowledge. We'll see you next time.
How do I go again? Or should I just leave it?